understand how this dog's walking.
In this week's Bondi Vet Compilation, our vets face the most shocking broken bone injuries
Oh my God.
they have ever seen.
Literally, that's just snapped off.
But will their expertise be enough
It's also possible we won't be able to fix it.
to save these innocent lives?
Because if it doesn't work, Blackie can't walk, and that'd be no future for Blackie.
At reception, a seriously injured 8-month-old kitten has just been rushed in.
Can we see your vet, please?
Yeah, no, I'll get Chris for you straight away. Just take a seat there.
Thank you. Cheers.
Blackie belongs to Michael's elderly parents.
Tell me what's happened.
Okay, well, he disappeared for a day and a half, mate, and all of a sudden he's just rocked up in the back porch and he's been meowing and, you know, he was actually dragging himself in.
So he dragged himself into the backyard?
Yeah.
Jeez. So no idea of what's happened?
No idea. It doesn't look like there's any blood, so...
Yeah. This might hurt a bit, mate. Come on.
Doesn't look right, does it?
No, the front legs are working okay there. It's got strength there, but
Look at that back leg there.
yeah, that's what worries me. So he's just hanging limp there? His back legs are basically in an absolute mess. That right leg is just hanging there with no sensation, no movement whatsoever. But to be honest with you, it's the other leg that I'm looking at most intently, because if that leg can't be salvaged, then Blackie has no hope. If he can't straighten out that leg, he can't support weight on that leg.
Oh, okay.
Yeah, mate, this could be a real problem. I thought we'd take a full body shot first of all, just to really check out exactly what's going on.
In the X-ray room at Bondi, Blackie is undergoing crucial tests.
There's no feeling at all in that tail.
No, there's not.
Are you seeing in there, right? This is just a bit of a check everything shot. What's that?
Looking at my boobs. It's my possum.
It's hard to avoid them right now. What is that?
It's a baby possum.
In the middle of the X-rays, another of the clinic's orphans has suddenly appeared.
Thought you'd slipped a chicken fillet there for a second.
Chicken fillet. Oh, it's actually the best way to warm him up.
Oh, I'm sure it is. Whatever gets you going, so.
The possum should survive, but sadly Blackie's X-rays reveal sickening injuries. One back leg is paralysed and the other has been badly fractured.
In terms of the cat having so many things wrong with it that you teeter in the brink of wondering whether it's actually worth keeping on going, Blackie's that cat. Oh, they're incredible. What he's been through and the injuries he has are just amazing.
At the Bondi Clinic, Michael is confronted with Blackie's X-rays.
His right leg should be sitting like this one here.
Why is it so far back?
See how there it's been pushed right through? So he's fractured his right femur, his right leg, basically where it inserts into the hip joint. And it's been rammed right through.
That's horrible.
He's never going to walk again with a leg like that. I know it's hard to take, but looking at that, we're going to have to amputate that leg. It just puts into perspective what he's done to actually get home, though. Dragging 2 broken legs.
He's a fighter, mate, that's for sure.
Telling anyone that their much-loved pet is going to lose a leg, it's one of the toughest jobs a vet has. You don't want to be in that situation, trust me.
Blackie's chances of survival now depend on complex reconstructive surgery to fix his fractured left back leg. There are no guarantees.
Put some pins in there to stabilise that fracture.
Right.
If we don't do that, I'm sorry to say, there's nothing we can do. I'll level with you. To me, that looks like he's been kicked from behind.
Just knowing that somebody out there could have inflicted this horrific injuries to Blackie is just horrible, isn't it?
What, for a laugh, for a cheap shot, to impress your mates? I don't know, but it sickens me.
Do your tricks, mate, and get him through, get him over the line.
Sure, we will, mate.
I just hope he's going to be okay. I'll be praying for him.
That leg's still pretty useless, isn't
Yeah,
it?
it is.
Hey, you'd be better off without it, mate.
8-month-old Blackie is about to undergo a marathon double operation. The kitten's life depends on it.
It's just amazing, isn't it? He's so agreeable to anything you do to him.
Yeah, he hasn't stopped purring the whole way through.
Chris and Dr. Tony Mossman will both be operating on Blackie. Tony is the clinic's orthopaedic expert.
All right, the moment of truth for Blackie. So I'm going to take off the right leg with amputation first of all, and Tony steps in and reconstructs that left leg. So let's go for it. I guess that an amputation sounds simple enough. It's just a matter of getting the leg off, but you do have to be careful, obviously, for the fact that there is a very big artery, a very big vein, and also a nerve in there. You've got to find those, just delicately remove them, tie them off, and then get on with business.
We're back up to 99.
Okay.
There we go.
There we go, Blackie. That's it.
Even era.
Job is now half done. We've managed to get that leg off. We now move on to the other side and complete the job.
Separate this fracture.
So what we're going to do here is put a stainless steel wire to stop it rotating, and then we put a small pin up the centre which holds it in position. Okay, now just put that back into position.
You just use the same tools at home, wouldn't you, Tony, to fix a broken chair or two?
Absolutely.
Chris, Tony did my cupboards as well. Yeah.
Really?
Yes, he did. Multi-talented.
Good job.
Very good job, yeah.
They're still standing?
Okay.
Still standing.
Straight? Oh, that's good. Looking good for you, Blackie.
Hasn't fallen over. Now, all we need now is the mallet. This pin now we'll drive up so that it's level with his joint surface, and that'll stay there permanently. Now test his leg.
Cats like Blackie can cope with only 3 legs, but having already lost one, it makes this reconstructive surgery even more critical.
It's obviously repairing a leg is always important, but in Blackie's case, this just has to be 100% straight and support all that weight, because if it doesn't work, Blackie can't walk, and that'd be it. That'd be no future for Blackie. This is outrageous. What have we got here? Hey Michael, how you going? Hello, how are you? I'm Chris.
It's the morning after Blackie's amputation, and the kitten's owner, Andrea, has just arrived bearing gifts.
Black. Thank you. Come on. Come on, let him
She's a bit shocked with what she sees, but
No.
it's just a bit difficult. You're not shocked?
I'm okay, no.
Yeah.
No. No. Because my husband lost their finger. I go to hospital. You okay, Mrs. Angeli? I'm all right with them. Nothing else.
She's just saying that it's just a shame what's happened to him. He shouldn't have to go through this. That's what she's saying.
But I can tell that he's happy to see you. I can feel that he's purring, and when he stretches his feet out like that, it's a sign of comfort.
Yeah, okay.
Yeah, it's nice.
The next step for Blackie is intensive physiotherapy,
There's still a little bit of swelling around the wound there, which we'd expect.
but he's not progressing as quickly as Chris would like.
We always give in.
She gives in. You give in.
The kitten will need tough love if he's ever going to get through the pain barrier and walk again.
Good boy.
Blackie, you ready? You going to show off? Show them what you can do. Come, Blackie.
Oh, wow.
Look at that.
Hey!
You're going to run off and hide.
I think so.
After 2 weeks of rehabilitation, Blackie, the now 3-legged cat, is ready to go home.
Blackie's just made a truly incredible recovery, and I'm almost in awe of the little guy.
Over the moon, man. This is awesome. This is great.
In the little roll there.
Yeah.
He's just getting used to his new body and the way it works now.
Yeah. Think of that. That's awesome.
See, Black. See, mate, you stay out of trouble, all right?
I'm just totally thrilled. I can't believe it. When I saw him the other day, he was just like down and out, but seeing him today and the way he's been moving around and that, no, just totally shocked more than anything. But it's a great result.
Blackie is now back to the good life at home with grateful owners Andrea and Antonius.
She's just happy, you know, in wife.
Yeah, very happy.
Yes, right. Thank you very much. Love me everything. Thank you. Thank you very much.
we're almost there.
Today, Alison is answering an SOS from foster carer Courtney about an extraordinarily brave rescue dog.
Dr. Ellison will be here soon. He will get you all fixed up.
So Courtney has warned me there's actually something seriously wrong with Baxter's back leg.
Good boy. Good boy. Baxter is super affectionate. He absolutely loves everybody. Our family has welcomed him like he's one of our own.
Badly mistreated as a puppy, he carries a severe leg injury which restricts his movement, despite a brave attempt to stay active.
It's a beautiful boy.
Hi Courtney, how are you?
I'm good. Thank you for coming.
Oh, my pleasure. This must be Baxter.
It is.
Oh, Baxter, you're so beautiful. So Baxter has a bit of a problem with one of his legs. Yeah, so you've noticed him being quite lame on it?
Very, very lame. Limping quite a lot, very unsteady. Baxter's limited with stairs. He cannot get up or down. He eats lying down. He does wobble a bit and his leg can give way. When he runs or walks, there is a definite limp.
All right, and it's been like that since he's actually come into care?
Yes. He was injured as a pup and he unfortunately didn't get any vet attention at the time.
My blood is boiling. I am so heartbroken and so upset to know about his history, that it's not something that happened yesterday. It's been going on for years. It's absolutely shocking to me, and my heart's broken to a million pieces just hearing this. I can actually see that he's limping quite a bit already, just from his standing up and how you're moving around.
All right, shall we have a look at you?
Good boy.
Yeah, you're not happy with that at all. He's got quite a bit of muscle wasting on those hind legs. So there's definitely an abnormality between the left and the right, just sort of halfway up his femur. He's got this huge mass. It's almost like a hard lump, and it just does not feel normal at all in there. Having a feel of Baxter, I can definitely tell he's in a lot of pain. He might have a really terrible fracture or break. He might have torn a ligament. There could be something catastrophic going on with that leg. I think we need to find out what's going on inside. So what we'll do is we'll pop into hospital, get some x-rays done, and hopefully get to the bottom of it.
Great. I'm extremely upset and heartbroken for Baxter because it's been so long. I'm really worried that nothing can be done now.
All right, Baxter, let's get that leg x-rayed.
Doctors are going to fix that leg up for you, hey? You're a good boy. We'll get you all better.
My fear is that it might be too late, that we're dealing with an injury that can't be fixed, which means that Baxter would be living with this disability long term. He'll be in chronic pain, and that's going to really limit his chances of adoption. Hi, how are you, Jeff?
Alison, how are you?
Good, thank you.
Good.
This is Baxter.
Hey, Baxter, I've heard a lot about this fella.
Alison has brought Baxter to veterinary surgeon Jeff to see if anything can be done to fix the brave collie's chronic leg injury.
Yeah, he's definitely got a really big swelling mid-femur, doesn't he?
Yeah.
And it feels like probably a previous break, but we're going to need to go to x-ray.
So Baxter's a little bit of a sad story. He was recently surrendered to Happy Tails Rescue, and he's been through several homes. Unfortunately, there was a bit of an issue and he was injured by one of the owners.
Yeah.
And he's probably had this injury there for about 4 years. So it's quite long-standing. I'm absolutely amazed how Baxter is still so happy and trusting, and he's had the worst thing ever done to him as a puppy, and it makes me want to fight for him more. Really just heartbreaking to know he's been in this much pain for all that time.
Well, he's such a happy character. I think if we can get rid of the pain and fix him, he'll get a home and
He will definitely get a home. I mean, his temperament is just gorgeous considering what he's been through.
He's totally trusting.
Look at him.
Hey, you big smooch.
I love that face.
You big smooch. Come on, let's go fix you up. We'll get an x-ray and just see what we think can be done.
Jeff and I have felt this horrendous lump on his leg. I'm actually really terrified about what we're going to see on Baxter's x-ray.
Okay, Baxter, let's see what you've got going on in there.
Oh my God.
Oh, that is nasty.
That is.
This poor guy has been through serious trauma.
What's amazing is despite the fact that he's getting around and he's being brave, the leg is snapped right in the middle, like a blunt force trauma or a kick.
I just don't understand how this dog's walking.
Yeah, it's amazing.
Would have been chronically painful. Despite his beautiful nature, he's hiding a bit of a beast in there.
He's been traumatised, he's been treated badly, he's just curled up in a ball and self-healed. But it would have taken months.
Yeah.
And months full of agony.
I'm so close to tears right now. That x-ray is absolutely horrendous. It's one of the worst fractures that I've ever seen. And for him to be going through this for so long, he's such a beautiful, brave dog.
How on earth does that heal?
The damage is so severe, surgery now looks unlikely.
So the concern is if we get in there and it's a ball of bone, it'll be very hard to get all that extricated without doing more damage.
The brave collie could be facing a future with a lifelong disability and little chance of adoption.
It's possible, but it's also possible we won't be able to fix it. So the bone is snapped and then healed, overridden. So this leg, it's 4 centimetres shorter than the other leg. I mean, if we can get this right, it'll change his next decade, because assuming he's around for another 10, 12 years.
We need to fix him. I mean, this dog is just a
He's
miracle
beautiful.
dog. He'll get a home. You know, we just need to get this sorted, get him pain-free. We've got to do everything we can. We might be able to get in there and do something about it. There's a small chance. It's going to be tricky. We won't know till we get in.
If we get in there and I don't think that we can really make a difference, then we'll back away. We'll just walk away, do no harm.
Surgery will go ahead, but with extreme caution.
I want to be 100% sure we can help him. His knee's rotated the wrong way. The leg's extremely short compared to his healthy left leg. It's a bit like a box of chocolates. We don't quite know what we've got till we get in there. But we wouldn't be here if we didn't really believe in our hearts that we're doing the right thing. So hopefully when he wakes up, he's got a leg that's 4 centimetres longer.
Fingers crossed.
Just working out the best approach because all the anatomy has changed. We're just trying to unravel the mess of scar tissue and bone and tissue without damaging any vital structures, because he's tried to heal a broken leg without any help. We've got a really complicated repair that his little body has done. The only thing that he's been walking on has been a ball of scar tissue. So I don't know how he's so happy, but B, how he's walking on this. Like, that's just...
How do you weight bear on that?
It should be impossible.
I'm a mess of emotions right now. I'm holding back tears. I'm angry. I'm sad. The force of impact to cause this sort of injury in a young pup must have been horrific. I'm extremely shocked.
It's abnormal, isn't it? Horrible. Oh boy. His muscle structure is so hammered.
Alison and Jeff are desperately hoping they can try to mend Baxter's mangled leg. But the possibility is starting to look extremely grim.
No, it's not coming off, is it?
I'm just absolutely shocked in how bad this is. He really was just weight bearing on a ball of scar tissue. The amount of pain this dog must have been in, just unbelievable.
We've got a complicated repair his body has done with some big changes to the anatomy.
It's just not normal looking bone, is
It's
it?
abnormal, isn't it? Horrible.
Baxter's leg break was so severe and so long ago. Jeff is now facing a painstaking process to try to untangle a badly healed mass of bone, tissue and muscle.
We're going to have to get nasty, Alison. Oh, that seems harsh. Look at that, that's moving, independent of the bottom fragment.
When they eventually reach bone, Jeff and Alison make the startling discovery that Baxter's fractured femur is still broken.
I'm now getting movement between the two bone ends. It should be impossible for him to put weight on this. Like, it would be like walking on a broken leg. I think it's a miracle that he hasn't severed an artery or damaged a nerve. There we go. Okay, we've got some normal bone here. Awesome.
Then finally,
we're getting somewhere, Alison.
A breakthrough.
I think it's possible, so it's well worth us trying to do this. We've got two beautiful bone ends. We can definitely trim the edges down to fresh bone, get it together, and then put a titanium plate along the outside. The second screw in. Things are going really well for him, so I'm thrilled. We've lengthened his leg by about 3.5 centimetres.
Yeah! Oh wow, I don't think it's well aligned as well. I couldn't be happier with how today went. Baxter's incredibly brave. He's been brave from the moment that I met him. He has to learn how to walk on 4 legs again. So Baxter has a very, very long road to recovery. He's gained an extra 3 to 4 centimeters in his leg length. So when he wakes up, he's going to feel different.
The surgery went really well. You have that leg back.
I'm so proud of him. There's so many people that love him, and the best case would be he gets a lovely home with an owner that knows about his injuries and just helps him along the way with the rehab. So, very pleased.
So from now, it's a long road of recovery ahead, but you're going to smash it, I know it. Hi, Courtney.
Hi.
Baxter. Hi, Darcy. How are you?
Look at that leg, the hair's grown back almost.
I know, he's doing amazing.
It's 3 months since Baxter's successful surgery to repair a severely broken rear leg.
You can see
Yes.
he's using the leg.
He's using it really, really well. He's far less wobbly.
Alison has arrived for a rehab session with the friendly 4-year-old, who's recovering well under the watchful eye of adoring foster carer Courtney and her son Darcy.
You feel like he's still in pain? Has there been any improvement?
I've seen a massive improvement in his pain. He's now seeking out to play with whoever he will play with, especially Darcy.
Baxter looks like he's recovered really well from the surgery. He's walking really well on that back leg. He's back to his normal self. He's really happy and confident.
I don't want him to fall over.
Oh, thank you. You are the best helper. Look at all this love you're getting. Hey? I wasn't able to even touch this leg last time. The fact he's letting me even extend and flex each joint is amazing.
Next, Alison sets up an obstacle course to test how well Baxter is using his refurbished leg.
All right, if you want to slowly walk him over. Yeah, so he hit that one. He cleared that one. He manages to clear some of them, but he doesn't lift it high enough, so he actually taps it or pushes it over. But he's not doing bad at all. I don't think I've met a dog quite like Baxter. He's gone from a dog that's been completely lame with the most horrendous fracture to a dog that's walking normally, is really happy, is really healthy. I'm very confident that Baxter will find an amazing family that will love him, and I'm really sure he's going to have a really bright and happy future.
While the search begins for a new home for Baxter, Courtney and Darcy are making sure this extra special boy gets heaps of love.
Dad, what about the peanut butter?
Darcy and Baxter have an amazing bond. From the moment they wake up to the moment they go to bed, they are together, on top of each other, next to each other. Darcy is absolutely in love.
Okay, Baxter, we will see you next time. He's doing so well. I'm sure he's just going to go from strength to strength. And I really, really hope that you get adopted soon.
Yeah.
He is just the best dog,
isn't he? We think so.
You do your exercises.
Bye.
Bye. See ya. Bye, Baxter. Hey. Yeah.
And great news for brave Baxter. A family is ready to adopt the courageous collie.
Does he like kisses?
Yeah.
How?
As soon as Baxter's leg has fully healed, he'll be the centre of attention in a loving new home.
Once Baxter's ready to go to his new forever family, Darcy will be upset like I will be, but it's been a pleasure and we'll love him forever and hopefully we get updates.
Hey Patrice, can you give me a hand with this girl?
On the Gold Coast, Alex is about to examine 1-year-old puppy Luna, who's been rushed into emergency after being hit by a car.
She's definitely in a degree of shock. I've given her some pain relief, but let's get her on some oxygen. Poor girl. And I just want to check out her wounds because she looks like she's got some pretty nasty injuries.
Owners Hope and Liam are devastated at what's happened to their precious girl.
We accidentally left the side door open and I heard the car and I just felt like something was wrong and ran around looking for Luna and couldn't find her, so I went out the front and then she was just hobbling over to me. Her front paw was all floppy, pretty devastating.
All right, let's see what's going on. I'm just going to go nice and slowly. I'm just going to start at the back.
Good girl.
Good girl.
Good girl.
It doesn't look very good back here.
There. Oh, darling.
Yeah. I can see underneath here she's got wounds. She's been dragged. Oh yeah, and on her belly too. Oh, she looks like she's got grazing all along her tummy. That would be so painful. Of course, we don't even know what her internal injuries are. With hit by car patients, you become extremely concerned about injuries like internal bleeding and head trauma. But I can already see she's got significant external injuries. Look at this, she's even got little wounds on her head. She's literally must have just tumbled along the ground. I'm going to touch it anyway, that hurts too much. I'd be pretty worried with the amount of her injuries. Okay. Girl. I'm just going to have a listen to her chest. Yes, it just... Okay. Chest sounds okay.
I know.
Yeah, I think we're definitely going to have to do some x-rays. Okay, see how bad the damage is, but she's only a little dog, and if the car hit her at speed...
Maybe some damage back there.
Yep.
Or shall I get her set up and...
Yeah, if you can pop her in a bed.
Yeah.
Okay, I'll come back and see you, all right, sweetheart? I'm going to fix you up. She's not even stable enough to undergo an anaesthetic. I'm just giving Luna some fentanyl now, which is a very strong form of pain relief. She's got some severe injuries there. We don't really know the full extent of it, but any dog that's come into contact with a car with the injuries that she's showing at the moment has got to be in a lot of pain. We're going to bandage Luna's wounds to prevent any further contamination, and also it'll make her more comfortable.
Luna's devastated owners are anxiously waiting for news.
I've organised for Hope and Liam to come through and see Luna. It's been a very distressing time for everyone. It's important that they have a chance to see her.
Just lie down, lie down, lie down.
If Luna was my dog, I'd want the chance to give her a cuddle. Okay, just down here. Okay, you all right? Hey Luna, look who's here. Look who's here. Oh, sweetheart. Oh. Okay, that's all right. Pop me away, good girl. It's okay, you see them soon, sweetheart. Know what some of Luna's injuries are, but I am starting to get worried about that left front leg, which she doesn't want to use, and she keeps holding it up. And if it's broken, we'll be able to see on the x-ray, but sometimes the injuries that we can't see can be worse than the ones that we can. I'm really worried about you, sweetheart. What have you done? What have you done? I'll get you some more pain relief before we even move you. Yeah, I think you're going to be too painful to move like that.
Alex urgently needs to x-ray Luna, but with shocking injuries, the puppy is in too much pain to be moved.
Luna's more painful now than when she came in. Often what happens is when they first get hit, their adrenaline's going and they're not feeling the pain so badly. She's been here for a little while now, and I think it's really starting to kick in. So we want to take her through to x-ray, but I think before we even move her, we need to give her some more pain relief because she's really uncomfortable. Good girl. There she goes. Okay. There we go. That's better. Okay, let's go. Good girl. Good girl. All right, sweetheart. I take the first set of x-rays of her chest. I'm looking for collapsed lungs, broken ribs. The chest actually doesn't look too bad. So there's no collapsed lung there I can see. Let's take the other side and have a look, but that's not as bad as I thought actually on her chest. Next we're going to x-ray her pelvis and her limbs. We're looking for fractures and dislocations. Okay, let's drop her the other way. Okay, that looks pretty good from that angle. Luna's pelvis is intact and doesn't appear to be damaged. That's good news. Okay, let's look at this front leg. Oh, let's see what's going on in there. Okay, moment of truth. Let's see. Oh, wow. No. Oh, that's a nasty fracture. Look at that.
She's not putting any weight on it.
No, that's... We take the x-ray and it's quite shocking. The leg is shattered. She's got a completely free fragment there as well. That's a really nasty fracture. Luna's humerus, which is the bone that goes between her shoulder and her elbow, is in 3 pieces. It's a devastating injury, but as an emergency clinician, you need to keep moving forward. You can't get caught up on one thing. We need to do a fast scan. The purpose of a fast scan, it's a trauma scan, essentially. So what we're looking for with Luna is any free fluid in her belly. If there's fluid there, it's going to be either blood, so internal bleeding, or she could have ruptured her bladder or ruptured her gallbladder. We're not looking at organ structure here, we're just looking for fluid. And I can see there that her bladder's intact, which is good. Okay, so I'm just looking at her kidney, looking for any fluid around there at the moment. I'm not seeing any, that's good. She's still in trouble, but not as much trouble as she might have been if she'd ruptured her spleen or her liver or anything like that. I know that Luna won't go for surgery for another day or so. Her contusions need to heal and there's swelling there that needs to resolve. Let's go. You're all right, darling. Okay, all right, let's sort your wounds out. So the plan for tonight is really going to be to clip and clean these wounds. They're heavily contaminated. There's literally bits of road in her wounds. So we need to clean as much as possible, bandage them. Some of this skin may also die off. So we need to wait and see what's going to survive and what's going to die. Poor girl, I think she's going to be in hospital for quite a while. Tomorrow she'll be transferred for the repair of her fracture and then the ongoing treatment of her other injuries. She's a beautiful dog with a wonderful family who love her dearly, so we're going to do everything we can to get her home. I got that leg. I'll leave you to rest for the night, hey? Good girl. You're a little fighter, aren't you? You hang in there.
At Scott's Richmond practice, Sammy is bringing in his 14-week-old kitten after he was involved in a nasty accident.
Hiya.
Hello.
Is this Kintosh?
Yes, it is.
Oh, he's had a bit of a nasty fall, hasn't he?
Yes, he has. So I thought I'd bring him in straight away.
Get Scott to have a look at it.
Yeah.
Poor thing.
He actually climbed up her door. He usually just pounces down onto the sofa. So what he's done instead is he's jumped the other side where it's wooden flooring, and he's managed to have a really awkward fall, and he's managed to hurt his hind leg, which is really sad.
Hey, Sammy, you right, mate?
Hi, Scott. How you doing?
Yeah, good, good. What's happened?
Oh, my cat's had a really awkward fall.
How far?
It's fallen from about 10, 11 feet.
Right.
From a door.
Wow, that's a huge fall.
Yeah.
Hello, sweetheart. Hello.
What's his name? Hello.
His name's Kintosh.
Kintosh.
That's a hell of a fall for a little man, isn't it? Yeah, he's not walking very well on that leg, is he? He's just hanging. Let's have a little feel, sweetie. Oh, sweetie. Oh, yeah. Bite the vet, that's fair.
Holding little Kintosh, I can see that there's something wrong with his left leg. He's not putting it down properly, and when I extend it, he's very sore.
Yeah, Sammy, look, I can feel some real grinding nuts and bolts type feeling in this hip here. So unfortunately, I don't think he's got away with this fall scot-free. So I think what's best is that I take him straight downstairs.
Yes, please.
Give him a quick x-ray and we can talk more.
That would be perfect.
All right.
Thank you so much, Scott.
You grab a seat.
Thank you. Thank you so much for your help.
Come on, sweetheart. Let's go.
I'm extremely worried about him. I just hope he's going to be all right. He's just a kitten. He's still a baby boy.
Hey, Gina.
Hello.
Look at this little kitty. Well, this is Kintosh, who's decided to jump off an 11-foot door.
Why have you gone and done that?
What are you doing?
Assisting Scott today is vet nurse Gina.
This left leg is a problem. So just...
You don't like that, do you?
See how that one goes down and that one.
Yeah, okay.
There's something going on in this hip area. So we're going to have to give him a little sedation and just see what's going on. And hopefully it's nothing too serious. Hey, hopefully it's nothing too serious. Hey. Kittens obviously are very energetic, bouncy little creatures, which is lovely when you're playing with them, but when you need to do something mean, like give them an injection, not so nice. Oh, we're sorry, we're sorry. Oh, poor baby, all right, all right. So we'll have to keep him a little bit still in order for us to be able to take an X-ray to have a look at his hip and see what needs to be done. X-ray. Oh, dear.
Doesn't sound like very positive noises you're making.
No, no, for very good reason. Look.
Oh, that's not good.
Poor baby. Hey? So, Sammy, here's your boy. All right.
Oh, Kintosh. Hello, boy.
On this left-hand side, there is a fracture. There's a break. I can see that. You've got a ball, you've got a neck, and then you've got the femur, so the thigh bone. And they sit into the socket, and that's the ball and socket joint, which is the hip. So the ball has come off from the neck. So when he's fallen, literally that's just snapped off.
Oh, poor Kintosh.
If you did nothing with Kintosh, eventually this leg will be completely non-functional because the head and the neck would still be grinding and rubbing against each other, causing pain. Kintosh would continuously lift the leg up, the leg would start becoming wasted, the muscles would tighten up, and eventually it would just be a withered leg hanging on the side of this poor cat's body. So what we need to do, unfortunately, is do what's called a salvage procedure, so a procedure which will allow him to continue to function, but he's not going to be perfect. What we'll do is actually go in and remove the ball, the femoral head, and a little bit of the neck as well. So he'll have a free-floating hip joint.
Okay.
Now, in a cat, all the muscles will take on the strength of the joint, and in time, he might have a slightly shorter leg, but you should never see it as an issue.
There won't be no limping or no lameness?
There shouldn't be, no. He should be able to jump and run and do all the normal things that a kitten should. Exactly.
Perfect,
yeah.
perfect.
But unfortunately, he does need to go through major surgery.
Unfortunately, yeah. My baby boy would be better.
Yeah.
Perfect.
All right.
Thank you for all your help, Scott.
No worries. You want to say goodbye to your little chap?
Bye, Kintosh. Bye. I didn't actually think it was that bad. To be honest, I thought it was a bruise or maybe a torn ligament. Fracture was completely out of the picture. It's really alarming. I just hope Scott can do a really good job and, you know, fix my baby boy up. Bye, Kintosh. See you soon.
All right, Sammy.
All right, then.
See you soon.
Thanks, guys.
Bye.
Bye. I'm extremely worried about him. It's going to be a devastating blow to me and my family if something was to ever happen to Kintosh.
Okay, let's knock this boy out then, shall we? Then, sweetheart. It's proper sleepy times now. Poor little Kintosh's hip joint is no longer effective, and I can't even fix it and place a pin or some screws or even a plate. It's far too short. So what I need to do is to actually perform a femoral head and neck ostectomy. That's basically going into the joint, removing the head, the ball of the ball and socket joint, remove any bony attachments to the hip altogether so that he'll now have a free-floating joint. Okay, happy?
Happy.
Right, here we go. So I'm cutting now, okay?
Yeah.
What I need to do with Kintosh is a major operation. Orthopedic procedures always come with risks, and to go fishing into the hip joint of a very young animal, there's the anaesthetic I've got to worry about, and one false move and things can go very wrong. How's our patient doing? All okay?
Patient's good. We got a nice strong heart.
That there looks just... Oh dear, doesn't look good, does it?
No.
I was hoping it was going to be much easier, being that it's a little animal that's not particularly well muscled, but actually it's just so tiny. And you can see that's the fracture there, that's where it's broken away. It just requires a little bit of patience to get it out without causing any other damage. It's a shame. In this case, it's better out than in. It's perfectly formed. It has just the fracture through it at the femoral neck, which is a real shame, but of course it has to come out. So what I need to do is now just take a little bit off of this neck. The final part of the procedure is to file down some of the femoral neck, basically to stop there being any bony contact between the thigh bone and the pelvis, and by doing so, give Kintosh a pain-free life. All right, Gina, so I'm just about to close up now. How's our boy doing?
His respirate, heart rate, all normal.
So surgery's all done and I'm pretty happy with the results. We've got the broken ball out of that socket and closed it up. So hopefully this little boy will work out a way to walk on a joint that doesn't exist anymore and he can use that leg and hopefully be comfortable. Oh, my little man.
Kintosh will sleep off the anaesthetic before heading home tomorrow.
Sweetheart, good boy. Yeah, fair enough. It's all right. You just rest.
Hello, how are you? Come on then.
After surgery to repair Kintosh's fractured hip joint, Nurse Sam wants to see how well the little kitten's leg is moving.
Good boy. Get you some physio.
It's really important that we start some physio with him, although at this stage we don't know how well his leg's healing.
Walking well on that leg, aren't you? Let's do it again. Good boy. I know. Don't get cross.
I'm very hopeful that Kintosh will make a speedy recovery and he won't have any lasting effects from the surgery. He's been so brave.
I know it's sore, but we have to do it. Good boy.
What you doing? What you doing?
Little kitten Kintosh has made a remarkable recovery and is well enough to go home.
Kintosh is looking so much happier. He's purring away. He seems pretty comfortable and he's already putting his foot down, which is a great result. Hi, Sammy. How you doing?
Hello, Scott. How you doing?
Kintosh, there's your daddy.
Hello, Kintosh.
Here he is.
Oh, I'm so pleased that he's coming home today. The house ain't been the same without him, and I'm really excited to get him home, you know.
He's been such a brave little boy.
Oh, I missed him.
But now I've done the surgery. All the work is yours, my friend.
Yeah.
So what you're going to need to do is quite a bit of physio. Now it's all down to Sammy. He really needs to encourage Kintosh to use his leg, and the best way to do that is with physio to ensure that Kintosh does use the leg quicker and more effectively in the future. So you just try and stretch. I know. So if you can manage to do it, last one. It will get less and less painful and become more and more easy for you to do. But he's a fairly forgiving boy. It is very upsetting that Kintosh has had to go through this whole process, that he's broken his hip and that he has needed to have this salvage procedure. But there is a silver lining in the fact that being a baby, hopefully he'll forget all the discomfort and the pain. And so hopefully moving forward, he'll leave all that baggage behind him and be a healthy, happy kitten who does run around like a normal cat should.
Thank you very much.
Good on you.
Thank
Good
you,
to
Scott.
see you.
Thank you very much for your help.
Bye,
Take care now.
See ya. Bye, Kintosh.
Hi, I'm Dr. Danny. If you enjoyed this video, then please remember to subscribe to the Bondi Vet YouTube channel. Click on the screen now to continue watching more great content.